So ischemia by definition is a reduction or complete loss of blood flow to a tissue or organ. And when we look at the consequences of ischemia, the how bad it is depends on the severity and duration of reduced perfusion. So what are the clinical outcomes of this ischemia? So ischemia could lead to tissue or organ atrophy. Remember, we spoke about atrophy in the past, which is a form of cellular adaptation, right? And this atrophy normally occurs in a chronic setting. So for instance, if somebody have underlying atherosclerosis, and over time that gradually reduce the lumen of the blood vessel, thereby leading to gradual reduction to the tissue. And then the way the tissue or the organ is going to respond to that is by atrophy. And that's why, for instance, if you have a 65-year-old man with uncontrolled hypertension, history of diabetes, hyperlipidemia, and now did a ultrasound of the kidney, and one kidney is smaller than the other one. And if you are asked, what do you think is happening to that small kidney? Likely that patient probably have renal artery stenosis, whereby leading to what? Atrophy, right, of that kidney. Very good. Secondly, it can lead to organ dysfunction, which could impair physiological activity, because if they are not getting enough blood supply, that means there's going to be hypoxia, and that could affect the function of those organs. And don't forget to watch the video on hypoxic cellular injury. Very detailed. It's going to help you. Also, the last one there is infarction, which is localized tissue necrosis from prolonged ischemia.